Since you did practice in medicine for a long time and as a pediatrician, what moments were there for you that were either very frustrating or very heartbreaking when a family had to decide to maybe forego treatment because they couldn't afford it? Did that ever happen in your time?
Well, you know, I'm thinking back even to my experience in Africa, and you know, our economic resources were way different than in the United States, and the resources we had for delivering healthcare were much more limited from a certain perspective. And somebody said, well, how do you practice medicine in a place where you don't have an MRI machine or a CT scanner or some other highfalutin form of technology? And my answer was, you know, it's the same thing. No matter where you're at, you're using whatever resources you have available to you to try to find the best way to care for the patient in the circumstances that you find yourself. And so it was always, you know, it's always a struggle. The resources are always going to be limited. And it's not a black or white, you know. When somebody, when you find that you know, it's my facility where I'm practicing doesn't have the necessary technological services, I have to transfer my patient. And in pediatrics, a lot of times these limits were not necessarily economic, because we have a tendency through sort of in Wisconsin through Medicaid to be able to find an avenue to pay for things that a lot of other people wouldn't have, you know, once they're no longer in childhood. And so we could oftentimes manage to find a solution economically, but I'm not sure that was just part of the deal of trying to be a physician, is to find the avenue where the most important resources to my child, you know, my child patient's care is one that we make available to us. But when it comes to, you know, the failings as a pediatrician for service to a family, I think my most regrettable or painful occurrences is when I would sense that we're losing trust. That for whatever reason, our ability to communicate is breaking down. Possibly because of my personal limits and personality. It wasn't clicking with another family, or just the physical, you know, being too tired to offer, or a multitude of reasons. And I would tell medical students that I was busy training that the pearl of what we do is that trust, that relationship of trust. And when you go into a relationship with your patients, what we need to do always is just to preserve that and protect that as the most important thing. And if we lose it, then you can understand how somebody would come back and say, you failed me. You really did cause me a lot of hurt, because I, as a patient, went to you as my healer. I disclosed to you things about me that I wouldn't tell anyone else, and I've lost that trust with you. And so the notion of tort law and lawsuits against physicians, for example, a lot of times it's because somewhere along the line we let go of that pearl, the essential character of that healing relationship, and that relationship between a physician and another human being who feels a need to speak to somebody who could be their healer.
Then how does your healthcare plan help patient-provider trust?
It allows the physician then to be able to focus on the patient and not on how we're going to pay for this. Yeah, it's immediate. It's immediate.
You know? It sounds actually pretty simple.